Yeah, and let's begin. Welcome everyone. Actually, this is my first live, so yeah, I'm super happy. This was a very spontaneous idea yesterday, but you might have seen my posts or topics I'm talking about at the moment, or often I'm talking about the 7 diaphragms, because that's a principle in osteopathy we use to or explain how the body regulates itself. And in this 7 diaphragm structure, we're not just having a structure inside the head. Then the topic we're going to look at today, the floor of mouth with a little bony structure. We're also seeing this area, the thoracic inlet, as a diaphragm. Then obviously our main respiratory diaphragm, our pelvic floor, and the knee and the arch of the foot. And you might have seen this. There is also a workshop with me about this topic, and I just today in this live wanted to give a little insight how our floor of mouth and this little diaphragm, as it seems to all the other ones, can influence our health and our posture. Some symptoms and issues we sometimes maybe find, and one of them is for sure a tensed jaw, clenching, but then even like symptoms which we all have faced at some point, like a tensed neck, and this could, like, I'm not saying it is, but it could be having its origin somewhere around this mouth area. And obviously this is not I can't diagnose anything. If you have symptoms, please consult a therapist or doctor. But sometimes we just need a little input, what we can do. And this is what today is going to be. So let's bring our palms together, arrive in the space for learning and for just sensing into our own body. And take a deep breath. And exhale, and as you exhale, you open your jaw, you release your jaw. Already sort of watching if this jaw today maybe has been tense, or if it's allowing you to relax and open your mouth slightly. What tension do you feel without touching? Do you feel it like one-sided? Is there density? Or maybe even even pain? And then as we open our eyes slightly, so you can watch me doing now, we just rub our hands together. And then we very gently, because it's a very sensitive structure, in the front of our neck, we placing one palm with the thumb and index finger really far up in that angle of our chin neck area. We can lay the other one on top, but there is no pressure yet. So, and with that little grab, you just with your fingertips start finding, like looking in this area, like see what tissues you can find, some cartilage, muscles, skin. How sensitive can you touch the skin, and then go deeper without clenching too much. And there is a structure that is a bit harder, and that is not just a cartilage. This is our hyoid bone. It's a very special bone because this bone is not attached in with a joint to another bone. It's just being held by the muscles of the floor of our mouth and our neck. And these neck muscles, some of them connect to the clavicular bone, to the first and second rib. And all these structures, the front of your neck, they are all influencing like how our muscles, how the running of the nerves and the veins and all the tissues that run from our head and neck into our body, how this is affected. And also, as we like now having our hands really close, there's our mandibular, there is our TMJ, and also muscles that connect the lower part, like the mandibular, to the back of our head. So if you take the other hand now and put it on the back of your head, and you swallow, you might even feel a tiny movement in the back of your head. And as you now holding yourself like this, in osteopathy, the touch is very gentle, very slight touch. We're not trying to induce or force something into our body. And now that you found this little card, like this little bowl, you can move your hands slightly to the right and left, as if you would move it on like a gliding surface. If you're familiar with yoga practice, and if you're a yogi, use Ujjayi breath. And also, like, you can move down a little bit further. For some, it's we are touching the front of our neck, with our airways, but just be super gentle with yourself, and then we release our hands. And again, feel free to do it with closed eyes. Bring it at the top of your mouth, the tongue to the top of your mouth, sorry. And then very slowly open your mouth, open and close your mouth. Just sense the opening and closing. Because now we're doing a little technique I've also just shared in a reel, but now I can explain it properly to you. As you bring your hands together, you're now bringing the thumbs at the bottom of your chin, again behind the bone. And before we do the practice, like, feel free to also massage this part, just like run sort of alongside the ridge of your chin. And towards the neck. And you might also feel differences in muscle tonus. I find when I use these techniques, I invite the breath. Like, it helps me to either relax and arrive in the structure. Inhaling, I feel like activity, and exhaling, I let everything melt. And then we keep our hands like this, like in a prayer position, but this time the thumb is soft underneath the chin. We open our mouth, and then we give a little press up. So our thumb pressing up, but the mouth stays in the same position, stays open, and then hold. Just keep breathing. And don't think like more force is doing more work. Like, stay in that position you're holding. Relax your face muscles as you keep your mouth open, having that little counter pressure between the thumb and the chin. And then slowly you move your chin forward, keeping the mouth as open as it was. And this is sometimes a bit hard to do, and I'm just practicing this myself. And you also pull it back, not just into the position where it was. Try to engage it backwards, as if you want to bring your chin as close to the upper spine as possible. And do it for a few times. It's not a big movement, but once we now do it for a few times, there's a lot of things going on in the jaw, in the muscle area around the chin and the floor of mouth. And then we slowly release. We're bringing back our tongue to the top of our mouth. And doing the same movement again, opening and closing. So we're letting our jaw and our mouth area learn again this movement. And as you release, also allow yourself to, next exhalation, wiggle. And with the next exhalation, bring your palms together again. This time we're taking the outside of our small finger and we bring it to the ridge of our skull. Like as I said, a super important connection to the front, to the floor of our mouth. And just rub rigorously, bring some energy, bring some awareness, some heat into there. Not on the spine, at the ridge. And yeah, you might have to do your hair afterwards, but it's, and when you now release again, release the mouth again, and just slowly bend your head from side to side, ear to shoulder. And even though you're not opening and your mouth anymore, as you exhale, you will still, with every exhalation, feel like a sense of melting. And without having to know what the name of the muscles are, what's connecting where, we find that out for ourselves as we go into these super slow, super fine movements. Releasing the first rib, second rib. And then slowly coming up. We again, and I always love to warm up my hands first. We bringing the hands in front of our neck. And you can use one hand or two, and we get in touch with the skin and the tissue underneath. There's like a muscle that is just overlapping everything, platysma. And we just gently, as we have the connection to skin and this muscle, run our hands down, bringing a little tightness into the front area. And inhaling, looking up. Stretching a little bit more. Exhaling, coming back down. All, like every tension in the front of our neck will have an influence. You can just keep going. I just talk a bit. Will have an influence on the structure underneath. But think what's underneath, like we're having like the vagus nerve coming down very deep with the big veins and arteries coming out of your head, going into your head, your airways, your esophagus, and your thyroid. Like also think about the organs. What could cause tension and what messages sending these areas out into the periphery and what is sending signals into this area. And sometimes we feel like it's not just the tensing, the clenching our shoulders. Sometimes we are stuck. We feel like words not coming out of our mouth, or we can't say what we want. Or we haven't been able to say what we want. So maybe also that's a reason why our area gets tensed. And then we just slightly run our arms across and just open your shoulders, your collarbones. Again, always with the connection into the floor of your mouth. few times. Use very intuitive movements. It's not just the shoulders, your head, your upper spine wants to integrate it all, because if we only release tension here, the tension that is arriving, like we need to, like, that's why we work, and this is where I'm coming from, why we work on all 7 diaphragms, because once we work on one structure, the other ones getting different information, like they're all compensating for each other. If the shoulder is rounding forward and we release this part, so maybe this diaphragm now takes up more of the stuff that is still sitting within the body. So like in yoga, we can't just, we're not working segmental. Yoga wants to look at the whole body, like one unity. This is what osteopathy does. And hence why we're not just treating the part where symptoms are arising, we're looking at everything. So now in a practice of the 7 diaphragms, I would look now into the head area, the shoulder and the diaphragm area. And if that's interesting to you, I invite you to take part in my big immersion, where we every week practice, and this today was just a little self-treatment, but we also do yoga practice, incorporating all these ideas and principles. And this could give you a deeper understanding for your own body. Hopefully you've found out this with this little practice, and also makes you more aware of how you practice in yoga or teach your yoga classes. So we know what parts to take in. And with this support, loads of things that we think come from posture or stability issues, they could just resolve itself if we continue practicing and if we continue to work with our body in awareness. So if you have any questions, I'm still here for a few more minutes. Yeah, happy to answer everything as much as I can. And if not, then thank you for being here. But if there's any other diaphragms you're interested in, trying to do this a bit more regular. I haven't been on here live, so I want to be more in touch. And yeah. Have a look if I see questions. Can I see questions? Or someone, 4 o'clock in the morning. I know it's very hard to find the right time zones. 10 worked for me with my kids at home, but I'm trying to do different time zones. Okay, but still I think you can watch the recording, and so all good, everyone can take part. Okay, so thank you very much everyone. I'm heading off. If you think about any questions, or if you use those things we just did for a little bit for yourself, yeah, let me know. Like, not just do it one time, come back to these little things and see what it does. And it's so good to put it into your daily routine, or even when you sit at work, you can do a little practice for the jaw and the floor of mouth. Okay, thank you very much. It was a pleasure, and see you soon.